Low carb cuts abdominal fat, triglycerides, and glucose. Raises HDL. Dr. Stephen Phinney.
On this complex graph, if you look at those factors which are outlined in green, those four factors outlined in green are the parameters that define metabolic syndrome. Abdominal fat content by DEXA was significantly, the loss was significantly greater with the ketogenic diet in red. Triglyceride reductions were dramatically better. Both the other groups were restricting calories, losing weight, so they were getting better. That diet is working to improve their metabolic health, but the ketogenic diet worked better. In terms of HDL cholesterol, there was about a 15% rise in HDL cholesterol with the ketogenic diet. There was no change with the other diet. And we see this over and over again, that we get a significant increase in HDL concurrent with the reduction in triglycerides, and you've heard in previous talks, that's a very powerful predictor of reduced atherogenic risk. And then blood glucose, which wasn't super high in these patients anyway, went down somewhat.
Further on this 2008 study of randomized controlled trial of low fat versus low carb. Further results, the low carb diet group lost more abdominal fat, triglycerides, and glucose. They gained more HDL cholesterol.
Insulin resistance measured by HOMA-IR, we saw a dramatic reduction in insulin resistance in this group. But the most paradoxical finding is on the far right, outlined in orange, and that's the blood level of saturated fat.
Their HOMA-IR, which is a measure of insulin resistance, went down. Total saturated fat in the blood went down.
Now, we've heard that dietary saturated fat, the evidence now is, and mainstream thinking is, it's not harmful if you eat saturated fat in your diet. But there is strong evidence that says the amount of saturated fat in your blood is a predictor of future diabetes risk, coronary artery disease risk, and mortality. Those on the ketogenic diet had much greater reduction in saturated fat in their blood, but they were eating 3 times as many grams of saturated fat per day. So if you were taught, and if you still believe that you are what you eat, red X. This is not true. You are what you save from what you eat. We get keto adapted, we more than double our body's ability to burn fat, and one of the preferred fats used in that fat oxidation is saturated fat. So it isn't going to harm you if you take it in, you turn it into CO2 and water. Tremendous benefit to your health if you reduce blood levels of saturated fat. And we've now seen that in 5 separate studies. This is not an isolated observation. And of those 14 biomarkers, 7 of them went down significantly more in the group on the high-fat, low-carb diet than in the control diet. None of them went down more in the group that was on the low-fat, high-carb diet. C-reactive protein here was one of the 7 that did not go down on the ketogenic diet in the first 3 months. It doesn't mean it doesn't go down. It means it doesn't go down in the first 3 months. It's a slow responder. So when you read papers that says that the ketogenic diet followed for a month makes CRP go up, hang with it, dude.
Edited and summarized, easy to share with loved ones. The description below the title for this video has these summary points.